Welcome back to WSAV News 3 today at 11. April is National Minority Health Month, a time dedicated to highlighting the unique health challenges faced by people of color and promoting health equity. Board-certified family medicine physician and founder and CEO of Harvest Health MD, Dr. Jamal Lawrence, joins us this week with more. Thank you so much for being here today.
Thank you for having us today.
So this is a serious topic because we know that minority health disparities in this country are preventable, but let's talk about these disparities.
Yeah, absolutely. So there are a ton of disparities when it comes to minority health. By far, minorities have worse outcomes when it comes to cardiovascular health, when it comes to treatment with pain, when it comes to just overall metabolic diseases and conditions. You know, a lot of these things stem from, structural underpinnings of how the healthcare system is built and how this country is built. But those things are, as you said, they are preventable, and they are things that we need to, as a community and as a system, look to find solutions to treat.
Okay, so as a doctor, how do you approach treatment and diagnosis with different patients?
So that's a good question. So I think one thing that's important to say here is that a lot of the times people like to think that because of their race or their genetics that their care should be vastly different. Now there are some nuances when it comes to genetic mutations or family history where treatments might be different, but there is less diversity in treatment specifically based on race. You will find certain medications that work better in certain populations, but a lot more has to do with the actual social drivers of health, previously called social determinants of health. People a lot of times overestimate the genetic and the biological components and underestimate the lifestyle choices that they engage in that actually has a bigger impact on the health. As a matter of fact, 80% of health outcomes have more to do with your environment, where you live, work, play, where you worship, your economic status, your education levels. That has actually way more to do with your overall health outcomes. Only about 20% of your health outcome is me writing a prescription or diagnosing or treating you. And so that's one of the reasons why it's important to come on shows like these, really to get a word out in the community that there are things that you can do to improve your health, and also to be a beacon and a light for those who are interested in driving this movement forward, because it takes a community effort. It's not just what's going to happen in the exam room. It takes the person that is interested in economic advancement. It takes the person that is looking at poor health literacy and how to educate our children and our youth. It takes the people who are looking at safety on our streets and transportation. All of these things have a way bigger impact. And then from a counseling standpoint, also counseling against reducing alcohol use, reducing tobacco use, and things of that nature.
Yeah, so that's what I was going to ask you. What would it take to achieve health equity overall?
That's a big question.
Yeah, it's a big question. It's a big general question.
Yeah, and so I think that one of the things that we are seeing, one of the approaches is to increase workforce diversity. And so that is getting more individuals in healthcare that look and reflect the population that you're treating. That's often an issue. There's a discrepancy between the demographics and the physicians. So an example of that would be that black individuals make about 13% of the U.S. population, but there's only 5.7% of doctors that are black. When you look at Hispanics, they're about 19 to 20% of the population, and they're only about 6 to 7% of physicians. And so you will vastly see disparities there when you look at ethnic Latinos, because they can't find people that speak the language. There might be cultural barriers. For African Americans, there's medical distrust, which is deeply rooted in the history of African Americans in this country. And so narrowing that gap with workforce diversity is definitely a thing. Systematically looking at the overall outcomes and making adjustments in how we treat patients. And then from a clinical standpoint, we as physicians need to look at the literature and really ask ourselves the question of why we're doing certain things. One of the examples of that would be discrepancy in chronic kidney disease for African Americans. And for quite a while, there was different equations or measurements that we would use to diagnose an African American with kidney disease versus a white individual. And after studies, and we go back and we look at the studies, we see that that genetic factor there, or the way that we would diagnose it, was incorrect.
Yeah.
And so there's a new equation now that takes out race. And so so that people are biologically being treated accurately.
So this falls in line with this week, which is Black Maternal Health Week, a time for us to raise awareness and activism about solutions to Black maternal mortality, the crisis that's going on right now.
Yeah, absolutely. You know, and this has been something that's been harped on for quite a while now, because it's incredibly important. You know, as a developed nation, we have some of the worst health outcomes, and so it's really saddening to see that because we have so much capabilities in this country in particular, and the wealth in this country to be able to address these issues. You know, I think it starts with obviously listening to the patient. You know, a lot of the times, individuals, patients in particular, feel like they're not heard. Feel when they have questions, when they have concerns, when they have issues with pain, they don't feel like it's addressed. And so it's important to really address the patient, and then also to be mindful of the community that you're treating, because where you're practicing will change how you practice medicine. Yeah. Right. And so the way that we might practice here in Savannah might be a little bit different than how somebody in New York would practice. The approach that you use in the community, the safety nets that you have available, and so being adequately resourced and being mindful of the approach is incredibly important. And
we saw this with Venus Williams, so that economics does not play a part in this most of the time.
Yeah, so that's an interesting thing. Even when you look at, for African American males, for example, when you look at education, when you correct for that, they still have worse outcomes, right? Yeah. And so you would seemingly think that with increased resources, increased finance, increased education, surely everything would level out, and that is just simply not the case. And, and so I'd be remiss if I didn't mention implicit bias in this conversation at this point, where we have unconscious predilections or judgments for people, and them being unconscious, we're not aware of them. And a lot of times that will affect how we treat individuals. And so I remember doing a lecture a while back about check yourself. And that is looking at your own implicit biases and trying to identify the blind spots that you might have that might affect your patient care, but also in the community. So
we're running out of time. We're actually out of time, but you do have a call to action.
Yeah. So it's incredibly important that I want to tell people to go out to find a physician that you trust, but to get engaged in your community. Reach out to your local community organizations and see where there is a need that you meet or a specific skill set that you have that can be useful to our community growing as a health-wise.
All right, Dr. Lawrence, thank you so much for joining us today. You can find more information and see this interview again anytime on our website by visiting wsav.com/communitycorner.